to everybody for coming. I'm really proud to say that we have got Ann Lynn Wires here, or no, Ann Lehman Wires here. She's with the Faith Family Medical Clinic. I was invited over there a couple of months ago. It's a fantastic facility. They offer full medical and all sorts of different services, including a really great wellness program. And it's affordable for people who are working. I mean, really, really affordable. So without further ado, Anne, would you like to take it away and tell people, oh, let me just say this. This is not typically what we do with SCORE. But I'm doing this because I see Faith Family Medical as a resource for small businesses. Every time somebody walks into Faith Family Medical, they lose $200. Faith Family Medical loses over $230. So it's definitely a nonprofit organization. They are funded through grants and large donors, but it is a way to provide to get affordable healthcare for yourself and also for your employees. So we're going to have Ann on quite a few times so she can talk about it, because I think that this is something we need to spread the word about. So anyway, please welcome Ann Lehman Wires.
Thank you so much. And let's hit that screen share. There we go. There we go. Can you see my screen?
Yes.
Excellent. Well, I'd like to thank you, Lisa, for making this possible. You are a wonder, and I am appreciative of you and what you do throughout the city and community, but also with SCORE. Do know this slide deck will be sent to you, so you don't necessarily have to make frantic notes. And of course, my information will be at the end, and you can always ask me questions. And there will be a time at the end of the presentation to answer your questions as well. So I pulled this slide from a presentation someone recently made to me. And reading that, and it is compelling. Yes, we know that well-being should be an integral part of our business strategy. We know that, but it's not always affordable. And it's an unfortunate fact that a significant number of small businesses and nonprofit organizations struggle to attract and retain their workers because they can't afford to offer them health benefits. And that is why HealthPass was created by Faith Family Medical Center 3 years ago. So this is more of a nonprofit term. HealthPass, the nonprofit term is social enterprise. HealthPass is the social enterprise arm of Faith Family Medical Center. It's focused on helping entrepreneurs, business owners, franchisees, nonprofit organizations, and any other employers by delivering low-cost, high-quality health benefit solutions for their employees. Now, I must say this at least once, if not 50 more times, as our attorneys require. HealthPass is not insurance. It is not an insurance program. It is a way to bridge the gap, as I've just said, and as Lisa said, the desire between an employer's desire to offer health benefits to their employees and their ability to pay for it. It's adaptable, it's easy to understand, and it is a way for us to provide medical care for patients, people, and your employees, or you, if you all decide to become a part of HealthPass, before the conditions become worse or too complicated to treat, to go further upstream. Often that is what we do with our patients at Faith Family Medical Center, as well as our HealthPass members. So through HealthPass, as Lisa said, we're able to expand upon Faith Family Medical Center's mission and provide our hardworking neighbors with affordable, quality healthcare services. So why HealthPass? Well, I know that you all are smart, but it bears my saying the reasons why. It's for people that don't have health insurance or they are underinsured, meaning they have a high deductible. We have 22 HealthPass partners, business partners, nonprofit partners, but predominantly for-profit businesses. And I have testimonials from them frequently, how it helps them attract new talent. I've had, for example, Christy Ryan, who is the executive director of Fanny Battle Day Home for Children, shared that one of her potential new hires at the time when she was interviewing, and then they chose to go with Fanny Battle, chose to work for them because they had HealthPass, and the other potential employer, same money, same hourly rate, didn't, so that employee chose to come to Fanny Battle because of HealthPass. Certainly helps to retain current employees. It reduces time off for illness. It can help with employee productivity or healthier. It helps with employee morale. And you only pay for employees who want to participate. That's really important to realize. It's not, you have to bring on your whole employee base, whether it's 1 or 3 or 30. You only pay for employees who want to participate. And did I say this HealthPass is not insurance? I think I did. So at HealthPass, with HealthPass, we have 3 products, which I'm going to go over. And before I do, I was presenting to a new partner, and they naturally thought, well, I need to budget as if every single one of my employees are going to participate in HealthPass. And that is not the trend that we've seen over the past 3 years. In fact, typically, when HealthPass is offered by an employer, between 5 and 40% of the total employee pool even participate in HealthPass for various reasons. So do know that. And the 40%, that's almost an anomaly. It's typically much lower. So just do bear that in mind. I think that's rather interesting. So HealthPass Primary is what we're starting with. I'm going to go back. $38 a month per participating employee. So this HealthPass Primary is the first product. And that allows patients or employees to come to Faith Family Medical Center for their care for a $10 copay. So what is Faith Family Medical Center? We know, and it's unfortunate, that Faith Family Medical Center is one of the best kept secrets in Nashville and the Middle Tennessee area. But we don't want it to be, but it is. So let me share a little bit about Faith Family Medical Center. It's a nonprofit primary care clinic. We began in 2001, so 23 years we have been serving patients. We serve people who work but don't have insurance or are underinsured. As Lisa said, on average, it costs us $234 to see a patient. So you have to ask, well, how can you afford to offer HealthPass Primary, for example, for $38 per participating employee per month? Well, it's because 80% of our annual budget of $4 million is funded through fundraising and the state safety net grant. So generous people, philanthropic organizations, and caring businesses who know the importance of health share their financial resources, their money, with Faith Family to bridge the gap for people who could not normally afford to have a healthcare home or health insurance. So that's how we can offer this at such an affordable rate. On this slide, you see what we offer through HealthPass Primary. Primary care, I've said that. Behavioral health. We offer behavioral health through HealthPass Primary through Faith Family Medical Center. We have a full-time psychiatric nurse practitioner who can diagnose, prescribe medications, work with the patient to make sure the medications are the correct ones, and she does some counseling. She also can work with the patients if they need more intensive counseling, to go somewhere else, or if they need help paying for it, Lauren Clanton, our psychiatric nurse practitioner, works with the patient to do that. But do know we're not pill pushers, so it may not be medication always. But that is what she can do. You see on the list our pharmacy assistance program, and that's for employees who participate or who qualify. Last year, that resulted in $3.2 million of free medications for our patients. And that is by applying to pharmaceutical companies to get free medications to see if our patients qualify. And remember, if someone is a part of HealthPass Primary, then they're part of that. And through other nonprofit organizations that give us free medications, we then provide to our patients for a $5 pass-through fee, so they have a little skin in the game. So let's delve a little bit more into Faith Family's Journey to Wellness program. Of note, everything that is offered through our Journey to Wellness program at Faith Family Medical Center is free, because of those donations that we talked about earlier. It is a way to not just work on, say, medications or other ways to modify and improve our health, but it's a way to augment that. We provide guidance for healthy behaviors, incentives. We encourage active participation in our journey to wellness because we know that knowledge is power, and that we partner with our patients so that they can learn behaviors to have a better quality of life. And when our patients come in, let's see specifically what we offer. Say if one of our patients comes in for nutrition counseling, and by the way, we have 2 registered dietitians, and again, all of this is free. They will see our patients as many times as needed. The patients can bring in a family member or a friend for any of these, because we know that they're more likely to participate if they have someone to help nudge them along. Often that's the case. You see, we have telehealth visits, and that includes not only with Journey to Wellness, but for our primary healthcare clinic. We have exercise and movement classes, a teaching garden where whatever the bounty is given to our patients when they come in, those herbs and vegetables and fruits are used during the cooking demonstrations. And it's just a way for people to see they can have a little garden in a small container, because that's what our teaching garden is, containers. We have diabetes and hypertension support opportunities through our chronic disease management days, wellness videos, cooking demonstrations, and much more. And they're all free. So recapping, what's offered through HealthPass Primary at $38 a month per participating employee, what we have just gone through. And of course, we do referrals for our patients who need something beyond primary care, which most people do these days. Of course, we do referrals to specialists, diagnostic testing, just a myriad of partners to whom we refer for our uninsured employees, and then can work with the insured employees. The next of our 3 products is the HealthPass Portable at $20 a month per participating employee. This includes Teladoc, discounted dental, and discounted vision. So starting with Teladoc. Through Teladoc, board-certified doctors offer diagnosis, treatment options, and prescription if medically necessary for a $15 fee. And this is all done virtually with Teladoc. Of note, if a company, business, nonprofit has at least 10 employees register, sign up for HealthPass Portable, there's a 0 visit fee. What's treated through Teladoc? I'm often asked. Well, colds, flu, poison ivy, respiratory infections, bronchitis, pink eye, sinus problems, allergies, urinary tract infections, and ear infections are some examples. And this is exciting. The spouse or domestic partners and dependents of the HealthPass portable employee or member, they can use the Teladoc and vision and dental discounts as well at no additional charge except for the visit fee. How does it work? How does Teladoc work? Well, they register online or via phone. Well, in the first place, once someone signs up for HealthPass Portable, they are sent a link to access all the information about what's available through HealthPass Portable. And if that's not someone's thing, there are actually live bodies who will answer phones through our partner of New Benefits. All of this, the portable's done through our partner New Benefits. So they access, and it's very well done. This company with whom we partner has done this for a number of years. So they register online or via their phone. They complete a medical history online or by phone, like you do at a doctor's office. And then the member will go online to schedule a visit. And then they interact with the board certified doctor, talking with them about what's going on and how the physician can help them. So, of course, there's a disclaimer. It's important to note that Teladoc does not replace the primary care physician. There's no guarantee that a prescription will be written. It operates subject to the state regulations, and they cannot prescribe certain medications. And you can see which those are on this slide. And being a person who I under promise and over deliver, I think it's very important for you to see what's included and the disclaimers. The next part of HealthPass Portable are the dental savings through the Aetna Dental Network. There are over 262,000 available dental practice locations nationwide. The reason we named this HealthPass Portable is because it could be accessed anywhere throughout the country. In most instances, members save 15 to 50% per visit, and specialty dental care such as orthodontics and periodontics are included. So dentists and other providers of dental care, they become a part of the Aetna Dental Access Network. And then the member could access them. And someone can look up the zip code near where they work or where they live to see what participating dentists are around them, for example, dentists who are around them. And they can even look up their own dentist to see if they're a part of them. And if they're not a part, they can even suggest or ask their dentist if they might consider being a part of the Aetna Dental Access. So those are good options. Like the vision, the members that I just described, they go online to find or call to find participating providers in their area. They get a membership card, as they do with HealthPass Primary, that they present. And of course, what is done needs to be paid for at the time of service. And another disclaimer, and I'll give you time to read that disclaimer. The third part of HealthPass Portable is the discounted vision, eye exams, and eyewear. So we have over 20,000, don't add a zero, 20,000 vision providers nationwide. HealthPass Portable members save 10 to 60% on glasses, contacts, laser surgery, and exams. Examples of participating chains are LensCrafters, Pearl Vision, VisionWorks, JCPenney, Target, and more. And like the others, they have a card they will present and pay at the time of service. So to recap, with HealthPass Portable at $20 per participating employee per month, it includes what you see on your screen. There's a third product, and that is HealthPass Premium. That is $50 a month per participating employee. And pretty simple, the HealthPass Premium includes everything available through HealthPass Primary and HealthPass Portable. And there's a $8 saving when someone signs up for both of those. So again, HealthPass Premium includes both of those. And again, a recap, this is going to be sent to you not only through the PowerPoint, but through a flyer that has this information. So let's talk about ideas for customizing. What have I've experienced in the 3 years of overseeing HealthPass. There's certainly the option that employees can pay a portion of what, the per member per month. The employer would just collect what that amount is and pay Faith Family Medical Center or new benefits, depending on which route is gone, in aggregate, one single payment per month. So employees could pay a portion. You could only offer one of the products or two of the products. Certainly, you don't have to offer all three of the products. Most businesses do, but you do not have to. And you can divide it up like in tiered offerings. I have some businesses to do this based on the number of hours that someone works, the length of service. They have to be there at least 6 months to qualify for something, for example. Or if they've been there X number of years, then they are rewarded with perhaps premium at not having to pay any amount. And those are just some examples of what our employers have done creatively. And they're, you may have ideas of how you might want to do it, and we can talk about that. So there are ways you can customize. So I have to ask, how would you like to offer HealthPass to your employees? I have a quote by Dale Harper. He and Compost Nashville. They were one of the first, they were early adopters, if you will, of HealthPass. And this is important to note too. This is very important. 22 business partners, I've told you that. We have retained every single one of them over these 3 years. I mean, I'm proud of that. That speaks to not only the care they're receiving, but the customer service that the employers received and the employees received. So that retention speaks volumes. So we range from a single entrepreneur to businesses with 65 full and part-time employees. We do serve undocumented employees. We do have clinical staff that 70% of them speak Spanish as well as English. Naturally, we have an interpreter line. So I could in no way cover everything about HealthPass and Faith Family Medical Center in an hour. It's hard for me to stay brief, but I have, believe it or not. So I have, of course, included my contact information. If you want to ask questions one-on-one, reach out or email, whatever you would like. I am here to serve. I am here to answer those questions and help you and your employees.
Anne, I've got a question for you.
Yes.
So is there some kind of cutoff? What if I am making $50,000 a year? Can I still qualify?
Yes, you can still qualify. There is no maximum for the uninsured. With the underinsured, people who have insurance but have typically a very high deductible, there's we list on our website, and that's why I would encourage you to go there at Faith Family Medical Center to learn more. So we do list the maximum that an underinsured can make, but there's actually lots of wiggle room with that. We just don't want someone making, $200,000 a year who has a high deductible to come to Faith Family Medical Center for their care. That's not what we're designed for. But for
Okay.
uninsured, there's no maximum.
Okay. All right. I've got another question. I'm just full of questions today.
Good.
So, what if I've got a couple of children and I get on the $50 a month plan, but my children have no insurance and I can't afford any insurance for them. Is there any way that I could pay either $38 or $50 a month to get them covered with me?
So with children, they are covered as a part of HealthPass Portable. So there's no increase in amount. HealthPass Portable, $20 per participating employee per month. That includes spouses, domestic partners, and children. So that's important to note. For primary, where the care is provided through Faith Family Medical Center, we do not see pediatrics. We don't see anyone who is under 18 years of age. So that's important to note. Lisa, I will say, kind of a little sidebar, we would entertain the idea of if an employer wanted to pay for their employee's family to participate, we would certainly look into it. We have not done that yet, and this is for HealthPass Primary, but we would certainly entertain that, look into it.
Wow. Well, that would be incredible. Okay, so you cover, I know I'm asking all these questions from a women's perspective, but so you cover like gynecological services and prenatal and all that?
Right. So yes to gynecological and women's wellness. So for example, the copay, and with HealthPass Primary, we know that's a $10 copay. It covers most all labs and most all services. There are a few services that it does not cover. But for example, a pap smear is $30 for a woman, which is amazing. We even have a partnership with Vanderbilt for some women who are under a certain income that can have the pap smear free. But typically a pap smear is $30. We don't do prenatal. We do refer out for prenatal.
Okay. Wow, this is it's mind blowing. So how many companies do you actually help?
So we currently have 22 companies on the roll, ready to take 100 at least more.
And what about solopreneurs?
I have one solopreneur currently, and he's been with us for 2 years. So that's a good question and leads to, is there a minimum number of participants? I have onesies and twosies, so no, there's not a minimum number. It gets a little more in the weeds when we start talking about HealthPass Portable and the requirements from new benefits, so that I can talk with someone if they're, say, under a certain number, and can go through that with them. But there's not really a minimum, certainly not for primary. There's not really a minimum. It just comes to billing, but I can go over that because it does get then more complicated, but not much, but there are a lot of details.
No, this is, I think this is, you laid this out incredibly well and really differentiated between what you do and insurance. So does anybody besides me have any questions? Because I think I've been sort of hogging this whole thing. Anybody want to put anything in the chat or or just ask. Anne would probably be really happy to take any of your calls one-on-one and talk about what she's offering. Plus, you might get an opportunity like I did to go over and see the facility. Oh, one thing that you didn't cover, Anne, is where is this facility? Can you tell us a little bit about it? Because it is awesome.
Yes. Oh, Lisa, you're so good. I'm gonna share again so you can see. Oops, there we go. Are you seeing that?
No.
Okay. There we go. You see that, right?
Yes.
Okay.
Yes.
So that is our beautiful building. We know it's not the building that makes it, it's the people inside providing the services and our volunteers helping. But that's our new building. We moved in 2020. You can see the downtown skyline behind us. We are at the corner of Murphy and 21st Avenue, just a block off of Charlotte Avenue. We are in the backyard, so to speak, of St. Thomas Midtown Hospital, and Centennial is on our side. We are on bus line, which is important to some people. So that's where we're located.
And the wellness, can you go over those wellness services again real quickly?
Certainly.
Because I thought that that wellness facility has bikes, and you do yoga in there and everything.
Yes, exactly. And to piggyback on what you said, Lisa, I would love to give anybody a tour as well. We give tours quite frequently and love doing so. So do know that that's part of offering too. With Journey to Wellness, the dietitians, we have two, as I mentioned, and that is, I was amazed that I think the quoted hourly rate to see a registered dietitian can be as much as $130, $150. So that's significant, as many times as the patient wants to come. We have yoga. We have some movement classes like Zumba has been offered before. We have a kitchen for demonstration for cooking. We have a space that can accommodate about 24 people that when you come for a tour, or even without a tour, we can talk about if you need a space for a meeting and if we might be a good fit where you can come to us for your meeting free of charge. So it is a lovely space. Our new director of the Journey to Wellness is certified in smoking and tobacco cessation use. So those are what are provided. Oh, and to go further into one other, which I didn't before, we have two disease management days that we provide for our patients, and there are 10 per year, so about one time per month. So, for example, for our patients with diabetes, they can come in free of charge, and we have stations set up throughout the clinic and in the Journey to Wellness, so they can see a provider free. They can speak to the pharmacist or pharmacy student about their medications. They can have an eye exam. They have their feet looked at because circulation issues. So there are loads of different places, different stations where the patient can come. Likewise, we do that for hypertension. So those are some of the examples.
That's fantastic. I also met a gentleman, really nice gentleman. He's not, I don't think he's a pastor, but
Right.
can you talk a little bit about what he does in collaboration with the center?
Absolutely. His name is Roberto Santiago, goes by Beto. He is an entrepreneur, has had businesses in his time on this earth. He is trained as a counselor and a pastoral counselor. So he can provide, again, free of charge, spiritual counseling if a patient would like that. He also has gone through a certification program to help identify for our patients some wraparound services that are available in the community. So like a social worker, certainly not the extensive education as a social worker, but a little piece of what social workers do, he can do, having gone through this community certification that he's done. So Beto is just very talented in many different ways and can wear many hats for us and for others. So yes, he is available and very memorable. And he speaks Spanish as well as English.
Yeah, super nice guy. I really enjoyed meeting him.
Good, yes.
Well, does anybody else have any questions, any thoughts, we've got the question and answer. You can put something in the chat. If not, I'm sure, I mean, Anne is gonna be, you've got her contact information. We will gladly send these slides out to you afterwards. Anne's around to talk to you. I'm not gonna say at any point because I don't want you to call her at 3 o'clock in the morning. But generally she's around and would be more than happy to talk to you.
Right, right. In the vein of not over promising and under delivering, but the other
Yes.
way, I do check my emails all the time. I'm a workaholic. I know it's bad, bad, bad. But I responded to someone asking a question at 10 o'clock on Saturday night. That's my exciting life. So yes, I might even respond at that time. But I appreciate everyone attending and your interest, and welcome to talk with you, connect with you. It would be my delight.
All right, thank you so much. If you need any more information, please reach out to Anne. She's going to be doing another one of these presentations in a couple of months. So if you want to, please let everybody around know about what they're doing over at Faith Family Medical, because it's truly a gift in this community. I'm very, very impressed. So thank you, Anne. Thanks for joining us at SCORE, and we'll see you guys soon. Thank you so much.
Thank you, Lisa. Thank you, Lisa and SCORE.
Absolutely.
Bye-bye.
Bye.